So people start getting it. And actually the time frame to me, I'm not worried about the summer, because as we're seeing in like Australia and other places, in the summer, this thing did not really take off. It's for whatever reason, more outside, more ventilation, whatever the reason is. I'm not a doctor. Don't hammer me on these things. But we're seeing this in the Southern Hemisphere right now. It's summer. It's not spreading as much. But we're in winter. People are indoors. We have surge going on all over the place. But in the spring, I'm worried about a certain amount of people are going to have gotten the vaccine. A certain amount of people will have had COVID. And my guess is it's going to start looking like normal come March or April, and it really probably shouldn't yet look like normal. So how do we go back to normal safely? And is it a passport? Is there a technology solution? I joked about the tattoo, but how am I going to know that Drex has had the vaccine and this person hasn't had the vaccine? And we get to next major holiday would be Easter or Memorial Day, that kind of stuff. When we start to get together again, how are we going to know we're safe?
Well, I mean, I think it's the same kind of thing we do now. And I think this is going to go on for a while. You're going to have your bubble. Probably a lot of people are going to continue to wear masks no matter what, even if they've had the vaccine. I think we're going to find out that people are going to say, you should continue to wear the mask. Yeah. Just because it's hard to say somebody not wearing a mask, did they have the vaccine, right? You get into this whole issue that you were talking about earlier. The whole passport thing worries me a little bit, because then that gets into the ability to do fraudulent stuff. I know that there were several companies that looked early on into this idea that you could go to NBA games if you took the survey about not feeling well, or if you had the vaccine or whatever, and then you could get into the game, really show up 15 minutes before the game, and you can get in. And otherwise you have to go through this sort of the line where they give you you have to pass through all the protocol tests. But man, I think it's still pretty messy. I think we're all very hopeful about the vaccine. We know that it's coming soon. You have some vague idea where you are in line, but there's all the messiness that's around this right now. And that includes, I mean, all the logistics stuff, right? The cold chain for some of these vaccines are really hardcore, and you don't want to get, I mean, if you get a shot from a spoiled batch of vaccine because it warmed up, you wouldn't know that. And what's that effect going to be? So there are a lot of things. I mean, even buying refrigerators. I'm talking to friends at health systems, and their health systems are buying refrigerators now. And then I'm talking to friends at smaller health systems in rural communities who are like, we can't afford those refrigerators. So how are we going to get the vaccine? This whole thing has really sort of continued to amp up the haves and the have-nots in healthcare, bigger health systems and rural health systems and smaller communities. And I think we're going to continue to see this exacerbated a little bit as we get into the vaccine march.